Hello, and welcome to the Art of Being Human. I've been working with diabetes, and we've come a long way. We've covered a lot of information, and so I'm going to gradually transition you into learning about the physical aspects of diabetes, which we're still working with. We're not quite finished with it, but we don't have too much longer to go. And transition you to what happens to you emotionally when you have diabetes. How do you react? Why do you feel the way you do? How hopeless can you feel? What can you do about your feelings? And I'm going to get into that. I'm going to start right now telling you some information and getting a little bit into the emotions of diabetes, and then going on to the more physical in a few minutes. But just in the last year, these are some figures that I've come up with recently. Just in the last year, 15 to 20% of new diabetic prescriptions were never filled. Okay, so let me repeat that. Within the last year, 15 to 20% of new diabetic prescriptions were not ever filled. Now, I can imagine probably there was a financial aspect to that, but if you have insurance policies, they usually help to cover. If you're in medication, if you're in Medicare Part D, they usually cover about half or more of it. So there is help available, and if your prescriptions are very, very expensive, usually there are special programs that you can get on. This varies from state to state, so you'd have to check with your own state. But you can get help with that. It also could be that you just don't feel like taking the medications, but I can tell you, diabetes is a very difficult diagnosis. It's very hard to live with it, and you should take advantage of all the help that you can get, because the only way you're going to stay safe with it, because of the complications that you can get, is to follow what your doctor says to do. It's very critically important. Now, to add to that 15 or 20% of those, and we're talking just about new prescriptions, of those new prescriptions that have been filled, which 60% or approximately were filled, a year later, most people aren't even taking them. So of the prescriptions that were filled, within a year later, only 60% are still taking the new medications that they have been prescribed. So we have, let me do a quick recap of here because it can be confusing. In the last year, 15 to 20% of new prescriptions were not filled, and of those that were filled, a year later, only 60% of the people were still taking those prescriptions. So it's important for you to take the prescriptions. You need to have them. But there is such a thing called diabetic burnout or diabetic distress, because when you start working with diabetes, you have to take care of yourself every single day. There's just no getting around it. If you're incapable of taking care of yourself, then somebody has to do it for you, because you just have to do it. When you first get diagnosed with diabetes, you're apt to go into a depression, you're apt to feel shocked, you're apt to ask the questions, why me, why now, why this? You start thinking of complications. If I'm diabetic, that means I'm going to have a kidney transplant, I'm going to go blind, and you start feeling very badly about that, and you go into something that's called diabetic distress. Now, I am going to get more involved with diabetic distress and discuss more of it later, but I want to mention it to you now. Now, the problem with diabetes is the fact that it's relentless. It never ends. You know, you can have the diagnosis, but you're never going to get rid of it. It is a chronic illness, and that means it's a chronic illness that it doesn't leave you. Unless a miracle occurs, you have that illness for the rest of your life, or you have that condition for the rest of your life. Just think of it like this. If you are, say you had polio as a child, and as a result of that, one leg became partially paralyzed, so you have to wear a brace in order to walk or something like that. It's chronic, so that means that damage from the polio is permanent. It's not going away. You have to deal with it every day for the rest of your life. Of course it's going to be very discouraging. Of course you're going to be distressed by that, because you've got to go into a period of mourning. You're mourning the loss of yourself. If you're diabetic, then you're in a whole state of existence that's different. You will actually have to mourn the loss of yourself, mourn the loss of your healthy self into the person that you are to become, which is a person who may be dependent upon insulin for the rest of your life. You see, it's chronic, it doesn't end. The other thing about diabetes that makes it difficult is it's progressive. It gets worse. You start off, you have some symptoms, you find out you're diabetic. Sometimes you don't even have symptoms, and you feel pretty good, and then the doctor announces that your blood sugar is way too high, you're diabetic, you have to have medication, and then suddenly it hits you. You're not the same person as you was, and that makes it very, very difficult. So I want to give you kind of an example I read recently in a book, and it made sense to me. It's a little bit like being a farmer, let's say a dairy farmer who has cows. You always have to milk those cows twice a day. It doesn't matter if you're sick, you don't feel good, you have a temperature of 104, you have to be in bed most of the time because you're sweating, because you have such a severe cold, you really want to go on vacation, it doesn't matter. You have to milk those cows twice a day no matter what. No excuses, you have to do it. You know, I met a friend of mine who went into law, and he says, in law school, there are no excuses. You have to take your exams. You have to go to these trials that they rig up for you so you can learn how to be an attorney. You have to learn all of the books. You have to know all of the law. You get tested all the time. It doesn't matter that you're sick or you've got the flu or if you've got a bad cold or you can't think straight. You have to do it. No excuses. Well, the same thing kind of applies to diabetes. When you have diabetes, you have to check yourself every day. You have to take care of yourself every day. There are no excuses. You just can't just skip a day. I had a friend of mine who decided that she was going to call a halt to diabetes, and that she decided that she would go on vacation from being diabetic. She'd been diabetic since she was a child. She was type 1 juvenile. And by the way, now you can get type 1 at any age. It's not just juveniles that get type 1. But she was diagnosed, this is years ago, with juvenile type 1. And she had insulin, all of her life. And she says, I can't stand it anymore. I'm sick of it. I am taking a vacation from being diabetic. Now, I had just been diagnosed. I wasn't on insulin yet. I was on medication, but I had to check myself regularly because I had to know how much medication to take and all of that. But she says, I'm just not going to do it for a week and see how I feel. So she took a vacation. She never checked her blood sugar. She never went on the diet that she was prescribed. She never did any of that. She lived what she considered to be a normal life. Get up, have breakfast, go out for the day, have an ice cream if you want to. Oh, don't bother with your blood sugar, you know. And by the end of a week, she was really sick. Well, I decided to try it too. I said, if she can do it, I can do it. And later on, she apologized to me for it because she said she had been a bad role model for me. I was just beginning to get into the regimen of being a diabetic, and she'd been in it for years, so she apologized to me, but she didn't need to. I was an adult, and I decided that, well, she got away with it, why can't I get away with it? So for a week, I never took my medication. I never checked my blood sugar, and sure enough, at the end of the week, I was sick, and I had to get back on track. Diabetes is relentless. You cannot stop your care, because if you do, you don't know what's going to happen to you. So what are people going to tell you when you first become diagnosed as diabetic? Well, they're going to say if you lost weight, you'd be better off. You wouldn't be diabetic if you weren't heavy. Other things they'll say, if you lose weight, it'll help you, but you need to walk as well and do exercises. If you can do your exercises and walk the way you're supposed to, you can control your diabetes that way. Or eat a lot of bran, eat a lot of whole grains. That'll help you because it'll somehow absorb the sugar or whatever, and it'll help you. Use this particular herb I just read about. It's so exciting. It stops diabetic symptoms in their tracks. And you can even drink coffee. Some people will tell you that you can even swallow coconut oil. Have you ever tried to swallow coconut oil? You can gag on that stuff. However, some people believe that it works. So there is a problem with people who do all of this. They are trying to be helpful. They're trying to encourage you. They're trying to give you hope. But most of those things that they're going to tell you, you're too far away from them. Maybe they would help before you became a diabetic, but after you're a diabetic, then it's not going to help. Most of those things just plain don't work. I know I've read about miraculous cures in books from diabetes. They took this regimen, they did that kind of exercise, and suddenly they had control of their diabetes and they didn't ever have to take insulin again. And I frown on it because for the most part, it's not true. And the thing that's wrong with all of this advice that you get, all of this free advice, is the fact that one thing, by the time that you are diagnosed as a diabetic, your blood sugar is already quite high. And most of the time you won't have known it because you haven't had a lot of symptoms. You'll be tired maybe you'll have excessive thirst, maybe you have to go to the bathroom a lot. There are various things, of course, that are symptoms, but you may not have all those symptoms. With me, I had a lot of foot infections. And I never gave it a thought. I blew it off. I'd go to the doctor, he'd get it bandaged, it would heal, and then the next month or two I'd have another foot infection. I did not have excessive thirst. I was not going to the bathroom too much. I wasn't hungry all the time. You know, the things that you usually relate, I didn't have those symptoms. So by the time that you get diagnosed for diabetes, you probably have been diabetic for 5 to 7 years without knowing it. So your blood sugar has gone way too high without your being aware of it. So it's already too late to start some of these innovative things that people say you can do to prevent diabetes. And the other thing is that that the diabetes is progressive. It's going to get worse. So a lot of those things won't help. But I also want to mention that by the time you are diagnosed, you are usually, your pancreas is already about 80% destroyed. In other words, your pancreas is getting destroyed at the same time that you are becoming diabetic. The pancreas is not working well. Now, it doesn't only produce insulin, it produces digestive juices too. There was an autopsy done years before insulin was discovered. And they took an autopsy of a man who died from diabetes, and they knew it was that. They had it diagnosed. There just wasn't anything they could do for it except have a person practically not eat so they wouldn't raise their blood sugar too much. So half the patients were starving anyway. But this autopsy was done, and the pancreas had shriveled up into just a little bit of tissue. It's like it wasn't there anymore. Now, I don't know if taking insulin shots prevents that from happening, but it might. But in the early stages, when they were doing autopsies and they wanted to know where was this problem coming from, why was the urine too sweet smelling, why was the person having a problem, and they discovered that the pancreas would shrink right up because it wasn't working and it wasn't being used and there was nothing to help it. In the 1920s, insulin was discovered, and then when they started using it, patients started living a lot longer. So people who will try to help you will say various things, but for you, even if those things are successful, and I'm not completely sure that they are, but even if they were, it would be too late to help you. And most of the time, you will have been diabetic for 5 to 7 years before you even know it, and your pancreas will already have been 80% destroyed. So that's something to keep in mind. So you may be able to help yourself. You have to constantly check check, like the dairy farmer, he has to constantly milk his cows. You have to constantly check. You need to give yourself time to adjust. You need to give yourself permission to even like yourself, because you may not like yourself. You may think it's your fault. There's something about advice that people give to you. It makes you feel that it's your fault, that you've got it to begin with. Never blame yourself. I think for the most part, people are diabetic because their grandparents were diabetic before them. It's in the genetics, it's in the genes, and if it is, you're not going to be able to avoid it. You may be able to slow it down once it gets started. You may be able to work with it, but it's not your fault that you have it in the beginning. It's too much like blaming the victim. You have to keep testing. You have to keep taking care of yourself. So that's kind of my word of advice. Now I want to show you, deal with some facts about circulation, continuing on from where we left off in the last show. Well, I talked about blood cells. I talked about hemoglobin being the substance that makes the blood cell red, and how it circulates and how it doesn't have a nucleus. Well, here are some other facts just to get us started. 250 million cells are destroyed and replaced daily. Remember, I told you, if you do remember, that blood cells last and live for about 3 months. I went over the A1C test and what it can do. Blood cells usually last for about 3 months. Well, daily, 250 million of them are being destroyed and replaced. They're being destroyed by the spleen, and they're being created by the bone marrow. Bone marrow creates red blood cells, and when they get to be 3 months old and they can no longer work and they're tired, the spleen will destroy them. And the spleen also produces the white blood cells that are the cells that protect you from infection. The body is 70% water, and all of it passes through the blood. There are 500 times as many red blood cells as there are white blood cells, and the red blood cells basically carry the hemoglobin. They become containers for hemoglobin. The white blood cells are made by the spleen, as I mentioned before. If there is an infection, then many, many more white cells are produced by the spleen, and in order to surround the infection and try to contain it and destroy it. If you were to take your arteries and veins, if you were to put them all together as one kind of conduit, you would find that the length of the veins and the arteries and the capillaries end to end would be about 12,000 miles. So in your body, you have 12,000 miles of cells, cells, capillaries, red arteries and veins, all of those conduits, 12,000 miles that contain the red blood cells and the white cells, you know, just as a conduit. So there's a lot about our bodies that are very, very important. I'm going to close it here, and I'm going to start off next time by getting into kidney disease. We need to get into kidney disease, and then after that, digestion. I don't know if I'll be able to finish all of it. Then after that, I'll be getting into gestational diabetes and Charcot's disease. And then after that, we'll be able to start to fully explore what happens to your personality when you're diabetic. So we'll close it here. Please join me next time.